but she had to have a different kind of anesthesia, and the meds that he gave her in order to help with putting you under a different kind of anesthesia and cover your pain during surgery makes you wake up really weird.
Okay.
So that's kind of how our PACU started. But you're doing fine now.
Okay.
So there's pink paper, has 2 follow-up appointments on it. So it's written on there, and then it's also written on here, and it's highlighted.
Okay.
She's recording because I'm gonna go over her discharge.
Okay. I didn't sign a release that I wanted to be recorded.
Oh. Did you have something important to tell me?
I do not.
So her first one's gonna be with Erin, and she's a PA, and that'll just be like an incision check. That one's on the 29th at 10:30. Her second one will be with Dr. Kramer. Okay.
That's the surgeon.
And that one won't be until November.
Okay.
So this is the most important part. So what they want you to do is rest, elevate, and ice over the next 72 hours, then ice 20 minutes per hour while awake.
Which means not going to work.
What do you do for work?
I own a flower shop in Burlington.
Oh, do you? Drink plenty of fluids. I would say, especially for you, because you need to wash out all those drugs that we gave you. Okay. You're in a non-weight bearing splint. So this is a plaster cast in here.
Okay.
There's kind of some hardness to it underneath. Non-weight bearing, you can utilize crutchers, walker, or scooter for safety. Do you have any of that stuff?
I have a scooter. They said they would send crutches home with me.
Okay, let me ask. Steve's who we need to ask about that. I'm gonna take you out in a wheelchair, so we don't have to worry about it right in here. But let me ask Steve. Then they do want you to take an 81 milligram aspirin daily for 2 weeks, as well as wear this TED hose. So we already put your other TED
And that's
hose on.
the baby aspirin, right?
Okay.
Yeah.
That's just to prevent clotting, because you're not going to be you shouldn't be very mobile.
Okay.
Okay. They want you to keep this dressing clean and dry. Do not remove until they'll take care of it when you see them. So you can cover it with like a trash bag or something when you want to sit in the shower. I would recommend just getting like a shower chair and taking a shower that way. Do not use any hot tubs, swimming pools, or submerge those incisions into any water until at least 4 weeks, until they're completely healed.
No hot springs.
Yeah.
No driving if you do take any of the narcotic medication. So looks like they did prescribe you tramadol. So it says on the bottle, but you can take that every 6 hours if needed.
Okay.
Otherwise, there's a recommended pain regimen listed on here of Tylenol and ibuprofen, and just rotating those to try to help your pain. Hopefully your blocks work for up to 3 days, hopefully. Like I said, yours was it took a little while.
He said to continue on with the Tylenol and stuff.
Even if you don't feel it.
Yeah.
Because that'll help with the swelling. You also may have a pretty bad bruise up here from that tourniquet.
Okay.
Okay, that's normal. Since you kind of have a history of nausea too, I would just go really, really light foods to start with.
No cheese.
Toast maybe, and just see how you do with that.
Okay.
But go home and drink a lot of fluids. That's always good.
Okay.
Let us know if you start feeling super sick and you're like uncontrollably vomiting, or you're having super bad stomach pain or anything like that. Definitely.
And you have a phone number?
They're all on here. Yep.
Okay.
Otherwise, this is the part that's more towards what you had done, an ankle arthroscopy. So we stuck a camera in there and kind of shaved it down and cleaned it up. It's going to be pretty swollen right now because we pushed fluid through there to visualize. Swelling, stiffness, and pain is normal.
Okay.
So I know we said the blocks should help, but it is normal to have a little bit of pain.
Okay.
Okay. If your pain's uncontrolled with the medication we're giving it, then you need a call.
Okay.
When after later on down the road, when you do get to have this dressing off, make sure you're taking a look at the incisions and they're not looking any sort of infection, like red, or the swelling goes away and then comes back. If it's draining anything weird, or it's really hot and gets more painful, definitely call us.
Okay.
So you have kind of a, on your incisions, the one on the lateral side where you're saying you
Yeah.
had the most pain, that's your biggest incision.
Okay.
Then there's little tiny ones. I think there might be 2 or 3.
Yeah.
Okay. Those were just where the little camera was. There's information on icing,
Okay.
so definitely ice it. Keep it elevated. Do not use this limb to support any of your body weight. It recommends you not to drive until you're able to put all of that weight on your leg.
Okay.
Do you use any nicotine or tobacco?
No.
Something about this plaster cast you should know, like don't stick anything inside here if you feel like it's itchy. Once your block wears off and it's feeling like it's wearing on you or it's like rubbing, call and let us know.
Okay.
Because there is hard plaster in there.
Okay.
So if once your block wears off and it's like, the dressing shouldn't be hurting you.
Okay.
Okay. So call if it is and we can take it off and readjust it if we need to. Any questions about any of that stuff so far? There's